Washington, D.C., and Oregon will open their COVID-19 vaccinations to all residents ages 16 and older April 19, as President Joe Biden is moving up his timeline for vaccine eligibility from May 1 and asking states to open up vaccinations to everyone by April 19. All residents age 16 and up in Alabama, Alaska, Arizona, Arkansas, Colorado, Connecticut, Delaware, Georgia, Idaho, Indiana, Iowa, Kansas, Louisiana, Michigan, Minnesota, Mississippi, Montana, Nebraska, Nevada, New Hampshire, New Mexico, New York, Ohio, Oklahoma, South Carolina, South Dakota, Tennessee, West Virginia and Wisconsin are now eligible to receive the COVID-19 vaccine. Utah and Florida's vaccinations are also open to those 18 and up. Texas and North Dakota have expanded eligibility to all adults, and Maryland has opened eligibility to those over 16 at the state's mass vaccination sites. April 7, North Carolina will expand access to all adults, and Maine will expand to all residents ages 16 and up. April 9, Missouri will open eligibility to all adults. April 12, Illinois, ages 16 and up, Kentucky, all adults, will open eligibility. April 15, California and Washington will expand to residents age 16 and up. April 18, Virginia will open eligibility to everyone ages 16 and up. April 19, Biden will direct all states, tribes and territories to open eligibility to the general public by this date, instead of his initial May 1 deadline, and Massachusetts, Rhode Island, New Jersey, Washington, D.C., Pennsylvania, Oregon and Vermont will expand access to all residents 16 and up. May 1, Hawaii has suggested they will only expand eligibility on this date and has not yet responded to Biden's new deadline. 167.2 million. That's how many vaccine doses have been administered in the U.S. as of Monday, according to the Centers for Disease Control and Prevention. An Associated Press analysis found states that had quickly widened which populations could get the vaccine, like South Carolina and Florida, actually had lower vaccination rates over those moving more slowly and methodically, as the rapidly expanding states may not have the infrastructure to cover the increased demand. If you're more targeted and more focused, you can do a better job, Sergo Ventures Executive Director Seema Skyer, whose health data organization conducted the analysis with the AP, told the outlet. You can open it up, if you have set up the infrastructure to vaccinate all those people fast. COVID-19 vaccinations have been quickly increasing over the past few weeks as supply has shot up, with Bloomberg reporting the U.S. administered an average of 3.05 million doses per day in the last week. Vaccine manufacturers Pfizer and Moderna have said they will deliver 300 million vaccine doses to the U.S. government by the end of July, while Johnson & Johnson, whose vaccine was only recently approved for U.S. use, will deliver 100 million in the first half of 2021. The U.S.'s infrastructure for administering the vaccine has also expanded as supply has increased. CVS recently expanded its COVID-19 vaccination program to 12 additional states, for instance, and the Biden administration has set up a number of federally run vaccine sites across the country.